Excessive menstrual bleeding and hysteroscopy. Anne was experiencing excessive bleeding during her menses for the last 6 months. She did not take any medical advice and thought that it was normal and hoped that things would settle. However, the bleeding was getting worse every month, and finally, she decided to see a gynecologist. After reviewing her, the gynecologist recommended a pelvic ultrasound. When the scan was completed, the report showed a thickened endometrial lining. The gynecologist then recommended Anne to undergo a hysteroscopy with a guided biopsy of the endometrium. Understandably, she got quite worried, and hundreds of thoughts started bothering her inside her head. She was flooded with questions which were slowly beginning to scare her. She wondered if the procedure would be a major or a minor surgery. Would there be any cuts, stitches, or scars? And would the procedure be under anesthesia or not? She was also worried about how many days she would have to take off work, and how soon she'd be able to do her household chores. She clearly felt quite overwhelmed with all of this. Her gynecologist then gave her a reassuring smile and answered all her questions and explained the procedure in detail. She explained that hysteroscopy is an endoscopic procedure where a fine optical system called a hysteroscope is used. This has a diameter of just 4 to 5 millimeters to visualize the inside of the uterus. The main parts that can be examined by a hysteroscope are the uterine lining, called the endometrium, the uterine cavity, and tubal openings inside the uterus. The gynecologist explained that it is introduced inside the body via the vaginal opening, and therefore does not require any cuts or incisions. This means that there is no need for any stitches or sutures. It can be done under general or regional anesthesia, as per patient's wishes, and the complexity of clinical presentation. The gynecologist explained that hysteroscopy could either be diagnostic or operative. When Anne asked about the difference between the two, she was advised that a diagnostic hysteroscopy is performed to: number 1, evaluate abnormal uterine bleeding, such as in the case of Anne. Number 2, investigate the reasons for infertility. Number 3, detect abnormal growths like fibroids and polyps in the uterine cavity. And number 4, investigate the causes of repeated miscarriages. The doctor also added that operative hysteroscopy is performed to: number 1, take a guided biopsy of the endometrium. Number 2, remove non-cancerous growths like fibroids or polyps. Number 3, insert or locate an intrauterine contraceptive device, also called an IUCD. Number 4, to correct uterine defects, which may be the cause of repeated miscarriages. And number 5, to clear intrauterine adhesions. Anne was further advised that after the procedure, she could have a painkiller and resume her work and daily chores in 1 to 2 days. She was made aware that mild cramping and bloodstained discharge may be noticed for a few days after the procedure, and the results of her biopsy could be given to her in about a week at a follow-up visit. Reassured and relieved, Anne leaves the outpatient clinic and walks over to the reception to fix an appointment for her hysteroscopy. We hope you found this information about hysteroscopy useful. Do share this animation. It might benefit someone. We welcome your questions, comments, and feedback, and appreciate you subscribing to our channel. We would like to thank Dr. Rinoy Sridharan, who works as an infertility and gyna endoscopy consultant in Mumbai, India, for providing us with the content of this animation.